weren't able to make it, or if you want to refer back to anything we talk about today. My name is Ashley Bullock. I am an educator consultant on the lead and toxics team, and I will be one of the project managers helping support this project for whichever project is ultimately chosen. And this RFP is called Reducing Toxic Exposures in Our Communities. My plan for today is to go over some of the key pieces of the proposal, to go over the innovation supports component of the project. We'll briefly look at some of the criteria for the RFP and what we're looking for in applications, the timeline, and then there'll be an open question and answers time as well. But we're a small group, so if you have any questions in the moment or need clarity, please feel free to just pop it in the chat or raise your hand and come off mute, and we can do questions in the moment as well. So our program is historically been focused on lead poisoning prevention here in King County, but we're looking to explore and expand our program to look at other toxics in our area. We know that toxics can, depending on which toxic we're talking about, can impact early development and learning, like lead. They can impact fertility for adults, and they can cause hormone disruption, damage to our different organ systems, and increased cancer and other diseases. We also know that we have a wide variety of exposure sources here in King County. Things like products and food can be sources for toxics like lead. We have historical and ongoing industrial pollution like the Tacoma smelter plume. Transportation emissions is a major factor for exposure to particulate matter and diesel pollution. There's also indoor air contamination, agricultural practices, and take-home contamination from our homes that can cause harm to children and families. We also know that not all families are experiencing these sources of exposure at the same rates or levels. Our program likes to focus on communities that are at an increased risk, which is partially why this RFP is focused on children and families who are at higher risk for health impacts from toxic exposures. But we also want to mention that due to environmental racism, not all communities experience the same types or levels of toxics. And many communities lack access to the resources that they need to counteract the harm that can occur when toxics are introduced into the environment. We especially know that discriminatory policies around housing, like redlining and segregation, have caused major disparities in who is exposed to toxics. But this also goes beyond just the housing. Folks of color are more likely to work in industries that have higher rates of toxic exposures, which can in turn mean that their children are more likely to be exposed to take-home exposures and other routes. So for the focus communities for this RFP, we're really looking at those who are the most impacted by toxics. And overlying that, since this is a BSK RFP, we're also really focusing on children and families. So some of the focus communities that we know are at higher risk for toxics include communities with lower income levels, Black and Indigenous people of color communities, children who are eligible for Medicaid, families who are living in subsidized or low-income housing, families living unhoused or with unstable housing, immigrants and refugees, and people who are undocumented or living in mixed immigration status households, families with parents and caregivers working in industries with high risk for toxic exposures, and other communities that live in areas with legacy pollution. So we're really looking for these RFPs to share how you'll be supporting and working with and a part of these focus communities who are most impacted by toxic exposures. As I said, the RFP is focused on children, pregnant people, and families, and they'll also be focused on the toxics listed specifically in these different lists. These are all from our state Department of Ecology and the Department of Health, and there are different programs that are working on identifying the chemicals that are the highest risk for human health. And these chemical classes were often described as the worst of the worst because they raise special challenges for society and the environment. For example, for the first list on there, they use 3 different criteria: persistence, so how long that toxic sticks in the environment, and how long it takes to break down or go away. Whether or not the toxic is bioaccumulative, which means over time it builds up in plants and people and animals. And the toxicity level, so how much exposure it takes for it to cause a toxic effect in either humans or wildlife. And this can include both immediate effects and long-term health effects, such as increasing risk of cancer. So we are expecting that the RFPs are focusing on one of the chemicals from these lists, although they're very broad lists. As I mentioned, our program has historically really focused on lead poisoning prevention in King County, and we've focused a lot on education to community and families, as well as to medical providers. And we've heard a lot, and we're seeing a lot with our community partners, this desire to move to more of a systems change and policy approach to the work. So we're hoping that this RFP is reflecting those priorities and giving some more room for community to tell us the type of work that they are interested in. We're looking to help organizations that are rooted in their communities to start or grow their environmental justice work. So it's not necessary that those who are applying have experience in this field. We're looking for folks who have an idea on how they want to grow their own organization's capacity and a strategy for how they can do that. We also want to start trying to encourage organizations to move beyond just education and outreach to think about programs that are more of a systems level approach. Just also a little background on our program, what we are working, this is a list of our current projects. So you can see it's almost all lead poisoning prevention, and we're really looking to get beyond that. We're working with medical providers throughout the UW clinic system to do some education on lead poisoning prevention and testing. We're working with community partners who are work primarily with immigrant and refugee families on education and getting them access to testing. And then we're doing some work with the Early Supports for Infants and Toddlers program, as well as work on the Tacoma smelter plume, which left legacy lead and arsenic in South King County and Vashon. Any questions on that background before I move on to the actual RFP materials? Feel free to put anything in the chat or raise your hand if you have a question. Okay. So let's dive into the actual RFP itself. So when we were planning this RFP, we really wanted to think about what our long-term goals were for the program, not necessarily how we were going to get there, because we know there's so many community organizations out there with great ideas of their own. So we started with our RFP outcomes and what we would like to see from these projects. And as a part of the RFP, you'll see that you're asked to at least be able to explain how your project will result in a minimum of 2 of these outcomes, although more is great. And the outcomes are to build skills and networks among community-based organizations, to participate in systems change and policy work, to increase cross-sector partnerships and collaboration focused on reducing toxic exposures, increasing data and research available on current and emerging sources of toxics in King County, and taking actions that support policies or programs that reduce toxics exposures. So we see these as sort of incremental outcomes that will ultimately result in policy change or programs that are taking on more systems level, although we don't necessarily feel that this initial round of projects necessarily has to get to that 4th outcome, although it's always a goal. And then Once we had defined our project outcomes, we thought about kind of the project types that we could really see resulting in these outcomes that we feel like we could support as a program. And we broke them down into 4 different project types. The first is community organization and coalition building to address toxic exposures. The second would be a community-based participatory research or citizen science project. The third is workforce development in healthcare. And the fourth is workforce development in housing, construction, or other high-risk industries. In the RFP itself, each project type has a description of kind of how we've defined those projects and examples. Again, we're not trying to be prescriptive in those examples. So if have a project idea that you're not seeing directly in the RFP, that is completely fine, as long as you can explain how they'll result in the outcome and how you feel that they sit within one of these project areas. Like I said, if you wish to propose activities not included in the RFP, that is great. Just please try to explain how your project falls into one of those project categories, clearly describe what activities you're going to be doing, and explain how those activities will result in your outcomes that you've selected. And as a part of this project, since this is a new area for our team and we'll be expanding, and we really want to support programs that are thinking about new approaches to toxics and toxics exposure prevention, we are partnering with the innovation supports team to offer innovation supports to whoever is selected for this RFP. And the innovation supports team is a group of BSK staff and consultants with expertise in helping organizations develop, design, implement, and evaluate programs and projects. Hannah, do you want to say anything about your team?
No, I'll just introduce myself. Hi, everyone. My name is Hannah Locke, and I'm the Best Starts Program Manager working with the Innovation Support Strategy. And I think Alessandra joined us today too, so she can maybe wave if she's there too. Thanks, Ashley.
Yeah, thanks, Hannah. And thanks for joining us, Alessandra. So the innovation support team, these are some of the folks that are on that team. You'll read in the RFP that they are available throughout the project period. This is just kind of one of their graphics that they use to explain the type of support that they offer, but they offer support throughout the entire life cycle of the project. Whether it's designing the program, developing it, evaluating it, or doing all the way through implementation. As a part of this project, we are asking at a minimum that your team work with the innovation supports team to create a practice profile and an evaluation plan. The practice profile is sort of like a project plan where you're defining the key activities and how they're going to be done and really tying it back to that outcome piece. And then the evaluation plan is the data you're going to collect and how you are going to show that you've reached your outcomes. And this is something you'll see in the application. It's an unrated question asking you about your experience creating similar tools and how long you think this will take. It's unrated because we know it can be a little challenging when you don't exactly know what is included. So do your best to just fill out what your experience is and based on what you're reading in the RFP, what you think that work will look like for your team. But just know that if you are selected, you'll meet with Hannah and her team to create a work plan and more clearly define the amount of time and how often you're going to meet and what you're going to create together. So let's see. At a minimum, what we're expecting is that you'll have 2 staff members take part in the innovation supports activities, that you'll develop an evaluation plan and a practice profile in the first year of funding, and that you will use some of your award funding to cover the cost of your staff's participation in these activities. And Hannah shared that for most partners, they develop their tools within the first 3 to 6 months, and they average between 8 to 15 hours per month on that work. And that information is included in the RFP. So you can use that as sort of a basis for thinking about it. If you know that your team is really good at evaluation plans, you've done things like this before, you can opt for a shorter timeline. We're just going to ask you to kind of explain your experience and we'll come up with a plan together. If you want, to continue working with the innovation supports team. They will be available throughout the life cycle, I believe. So that'll also be an option to talk about if you want their support longer than just creating those 2 tools. So this is really meant to just be a space for your program staff to be supported in thinking about how you're going to implement this programming. Any questions on the innovation supports piece or the earlier RFP pieces? Okay. So a little information, I didn't pull all of the criteria for the RFP. I can go into that if there are questions, but please make sure to read the RFP rating criteria. What we're really looking for applicants are folks who are upholding and centering community needs, strengths, and interests throughout their decision process, throughout their programming, all the way through their evaluation. That they're seeking to build relationships with other organizations and community members from the focus communities that they're serving. That you're intentionally designing your programming to be reflective of the communities you're serving. Whether looking at language access needs, as well as thinking about how actual community members are involved throughout the lifespan of your project. And that you're recognizing and seeking to address historical and current systemic racism and structural violence that puts communities of color and other focused communities at increased risk of toxic exposures. It is not imperative that you have a background in lead and toxics work. And also I should mention that partnerships are also encouraged. If you are interested in doing a partnership between multiple organizations, you can apply together with one organization as the lead and the other as a subrecipient. Some details on the RFP. So the funding that is available, it's a 3-year project. And funding is available $750,000 total over all 3 years, or $250,000 per year. We're anticipating awarding between 1 and 3 partners. So you can ask for the full amount if you have a project that's within that funding range. You can also go apply for smaller amounts. Our anticipated contract period is between July 2024 and June of 2027, and the applications are due April 17th. Here's the timeline for this whole RFP process. So the RFP was released on the 21st of February. We have our second online info session. So if you have more questions, we'll have another one of these sessions on March 18th at 2:30. Technical assistance for applications are available through BSK for free, and that is available until April 9th. That's the last day you can request technical assistance. You can contact our King County contracts manager with any questions regarding this RFP up until April 9th. And then the application due date is April 17th. We will review the RFPs in late April and early May, and we are hoping to notify folks in early June and start the contracts in July. The RFP will be reviewed by a panel of BSK staff and community partners. Those staff members and partners receive training on anti-bias related to the RFPs, and they will also be using the scoring criteria that is in the RFP. So make sure to look at that closely when you're writing your answers. It's usually a multi-part process where the RFPs are reviewed individually, and then there's the group that will get together and discuss the different applications. And the recommendations will also be reviewed and approved by BSK leadership and King County Council. So it's an intensive process that we go through to make sure that we are considering all of the strengths of all the different applications. Again, there's technical assistance that is available through BSK. They can assist you in determining if you're a good fit for the program. They have met with me previously and our other staff to discuss the RFP and are familiar with it. They can provide guidance on how to answer questions, where to find data that supports your application, and they can review your application as well. And when I post the slides, this is a link to the technical assistance. Let's see. So the next info session, as I said, will be March 18th at 2:30. You can see that online on the BSK blog. You can email your questions to CPRES. Anything related to the RFP, they will answer. Let's see. We also highly encourage you to review the glossary of terms in the RFP and the rating criteria, as I've mentioned, and review the RFP instructions to make sure your application is complete before you submit it via Zoom Grants. Any questions? I know some folks joined a little later, so I'm happy to go back if anyone missed any pieces. Amy, is there anything you would like to add?
No, I think you did a great job of covering it, Ashley, but I'll introduce myself. I'm Amy Schumann and I manage the Lead and Toxics program in the Environmental Health Division. So appreciate all of you being here today and your interest in the funding.
Thanks, Amy. Well, if there aren't any questions, I can just hang out here for the next 10, 15 minutes. And if something comes to your mind, I will be here. I'll leave the recording going. If not, highly encourage you to reach out to the TA team and to join us on March 18th if questions come up for you for the next session. We will be just basically covering this exact same slide deck, but we can answer any questions that you have as you start to go through your application. But thank you, everyone. Thank you for joining. Thanks, Danielle.
Thank you.
Bye. Thank you.